the impacts of ACEs and toxic stress on Indigenous communities. And this is just really looking at preparing for trauma-informed care in Indigenous communities, which really is about self-reflection. And sometimes we don't realize this, that when we're working with other peoples, that we are influenced by our own worldview, our own values, our own beliefs, and our own experiences. And so the first step into creating nurturing, culturally sensitive, trauma-informed environment for the communities to which we work is to really be aware of how our own perceptions influence our interpretations of reality. And so this is the learning objectives for this training, for this module, is to describe how providing trauma-informed care for Indigenous communities of California must include an understanding of their histories and how these experiences relate to intergenerational transmission of adversity, as well as protective factors from an Indigenous perspective. And so also another objective is to describe how the content of these modules support screening for ACEs and treatment of toxic stress in Indigenous communities. And in addition to that, we've also defined the adverse childhood experiences. And so at the end of this module, participants should be able to identify trauma-informed principles, as well as how they relate to Indigenous communities by defining worldview, epistemology, implicit bias, explicit bias, and multilogical thinking and reflecting on clinical responses to identification of ACEs and increased risks of toxic stress. And so we'll be talking about each of these definitions here in a moment. And so when we talk about trauma-informed care principles, these are some of the things that we're talking about. And so establishing the physical and emotional safety of patients and staff, to build trust between providers and patients, to recognize the signs and symptoms of trauma exposure on physical and mental health, to promote patient-centered, evidence-based care, ensure provider and patient collaboration by bringing patients into the treatment process and discussing mutually agreed upon goals for treatment, and then to provide care that's sensitive to the patient's racial, ethnic, and cultural background and gender identity. And so, as I was saying, in order to do this, we really have to reflect on ourselves. And so this piece here requires some interaction with those of you that are in this workshop. And the first thing in the self-reflection is to identify two core values that you feel are important to teach children within your circle, whether they're your own children or they're children that that are a part of your family or within your friends. What are two things that you think are critical to teach to your children? And so if you can go ahead and write those down on a piece of paper, and I'll give you a minute, and then I also will ask you to share or put into the chat also. So please be prepared for that. So the question is, what are two things that you feel are important to teach to children? And when you think about these two things, for each of these values or skills that you identified, what are the experiences that might have influenced you in this decision? Okay, and so you think about two things that are core values or skills that you think are important to teach to children. Is there anyone that is willing to share a value or a skill that you believe is important? If not, it's okay. There are some that I can list. Mm-hmm. And so sometimes when people identify this, they might identify things like respect or relationship, sometimes language, sometimes connection with family. But the thing that's important about this is that when we identify things that are important to teach to our own children, um, that it is often associated with our own experiences, something that influenced us in this decision. And so often we revert to our own childhood. And so when we think about what is important, sometimes it might be something like honesty. And maybe it's because it was ingrained into us when we were very young that it's important to be honest. Or maybe it was the opposite. Maybe honesty wasn't a value within the household. And through experiences, we learn that that is something that's very important. And now it's a skill that we want to teach to our own children. So we as human beings are attached to our own values. We're attached to the importance of these skills to teach to our own children, our children within our circle. And why this is important is what we don't realize sometimes is that when we're working with other people's children, is sometimes we still have these same core values of what we think is important for them to learn. And sometimes we don't understand that their parents and their caregivers actually have identified core values and skills of their own that they feel is important to teach to their children. And so the second question here is then to identify two privileges that you have. And when we think of this word privilege, we think of it in terms of access, access that we have that maybe other people don't have. And whether it's long-term or even temporary access, is that sometimes we have privileges that we don't necessarily ask for, or maybe we feel like we actually work for them, but there's still an access. And so at Humboldt State, for example, it's called, or referred to sometimes as Hills and Stairs University. And so I often have students, that know how to get on certain elevators. They don't have to go up different hills, and, they don't have to go up different sets of stairs. And there's often, complaint about that. But I've also had students who have temporarily been disabled. So they actually become immobile to where they can't navigate campus. And then they learn how difficult it really is to get around campus. I often think of a story of when I was pregnant with my son at Humboldt State. There's these chairs that you get into and you have to get in sideways and then you turn to sit in the front. And I was pregnant, and so I could not turn my chair, and I had to look at the whole for 3-hour meeting. I had to sit sideways and look forward. And I began to ask, people that aren't within a certain size, how do they find seating in this building? So sometimes it's not until that moment when we don't have the access we've always had that we actually start to really think about access and think about how easy it was for us before. When a student was able-bodied, how easy it was for him to navigate campus, how easy it was for me to sit in the chair at a time when I wasn't pregnant. These are topical kind of examples of privilege. But it gets deeper into levels of privilege also. And that's something also that's important to think about. We think about a privilege of having parents, for example, of having two parents, maybe. Privilege of, some may see something as a privilege that someone else may not. So having a sibling could be a privilege. Not having a sibling, someone might see as being a privilege. But it goes into even deeper levels. And we think about historically, for example, when we look at Talawat and the massacre that happened within Eureka and what's now called Indian Island, we think about those families that, participated in massacres of Indigenous peoples and now are owners of lands all throughout Eureka. And now their grandchildren have maintained wealth and their status, who may feel that they worked very hard for what they've worked for, in many cases have worked hard, but aren't aware that sometimes this privilege is connected to these types of historical events. And so really thinking about what privilege means and being aware of our privileges. I think the funniest meeting I ever was a part of was trying to figure out how to get educational classes to rural areas. And the first thought is internet. Where in some of the rural areas, you know, you're fortunate to have electricity, much less Wi-Fi connection. And so really thinking about all of these different forms of privileges. So when I ask people to identify privileges that you have, this is the reason why I ask people to do it, is because we all have privileges. And even when we come from backgrounds that have been challenging backgrounds, we still have certain levels of access. And sometimes the access is seen in different ways depending on the community that you're in. For example, being an Indigenous person in academia sometimes is not really a privilege. Whereas being an Indigenous person in an Indigenous community sometimes can be a privilege. So it's important to keep these things in mind. And why this is important is because all of these things influence our worldview. And our worldview is our values, our experiences, and our beliefs. And I always think of it like a pair of glasses, and it's this lens. And everything that we see, we interpret it through our own values, through our experiences that we've had before. And even if we're sitting right next to somebody who might be our best friend or might be a sibling even, when we watch an event happen, we interpret it based on our own experience. It has our own interpretation to it. And our epistemology is how we make sense of things. So a worldview is our value, belief, and experience. Our epistemology is then how we make sense of it, or kind of our rule in working with families and children and communities. So I think of, you know, when my husband and I, before we had children, we would go to Applebee's, and we're sitting there having dinner, and we hear the baby in the booth next to us, and the baby's crying. And of course, we're sitting there and we're saying, when we have children, our children are going to sit quietly, and they're going to eat all of their vegetables. And we have this whole image of what we're going to do when we have children. So it's based on our own worldview, our experiences not being parents at the time, our own values and beliefs at the time, and then our epistemology is this rule that this is how our children are going to be, right? And worldviews change. So now we have children, and of course, at Applebee's, my rule is if they're within the booth area, then we're good. I mean, if they're under the booth, okay. If they're on top of the table, okay. But they're in the area, then we're doing good. So the epistemology and the worldview changes with new experiences. And we grow, we develop, we evolve. I also think of this as a professor. I couldn't wait until the last time I did a paper, because I thought I would never have to do a paper again. And little did I know I would be, you know, required to do all sorts of papers and then have like desks full of papers to grade. So my epistemology has changed. Now I'm thinking student life, you know, isn't so bad. But our worldview is our perception of things. And that's so important, because when we're working out in the community, when we're working with children, when we're working with families, our own worldview, our own values, beliefs, and experiences influence our interpretations, our expectations, and our assumptions of the children and families that we're working with. And so to truly be trauma informed and to truly be culturally sensitive, it's so important that we understand what influences our own lens, what it is that we see as important, what we see as valuable, and how we may project that onto other people's. And so part of development is that within the first 5 years of life, children develop a self-concept. And this self-concept is everything they've been immersed in through their surrounding environment, from their parents, from their extended family. Sometimes it might be ceremonial families, or maybe even a religious group that influences this child's development. So in the first 5 years, they've already established this sense of worldview, of self-concept. And then when they go into the classrooms, when they're school age between 6 and 12, is when they really start to develop their self-esteem. And that's when they start comparing their views with other people's views, other children's views. And oftentimes their self-esteem will plummet within that first experience and being around other children. But then they begin to see what their strengths are. They begin to be okay with what their weaknesses are, and this is how their self-esteem develops. And when they get into middle school and starting to move into their adolescence, they start becoming concerned with their social identity. So this is how they feel about how other people perceive them. And they become concerned with how people see them. And once they begin to establish a strong sense of social identity, then they move into self-efficacy. And that's in high school when they start to see what their purpose is in the world. And then eventually they move into self-actualization. And self-actualization is when they start working towards those goals of what it is that they see themselves doing and contributing. But in order to get to this pyramid of them being able to work toward the goals of their purpose in the world, they have to have a strong self-concept. And that's established within the first 5 years of life. And so oftentimes when we interact with children, it's so important to understand that they already have their own values, beliefs, and experiences that interpret their own perceptions of reality. And while we have our own worldview, so do the children and the families that we work with. And so an example in just thinking about everyone has a different worldview and a different perception. But an example of an illustration of a worldview is this diagram was done from a study that had done called Kiwanyanyan Ma'ohunu, and it was asking Hupa Yurak Karuk parents, what are the 5 most important things to you to teach to your children? So just as I had asked you earlier, what are the 2 most important things to teach to your children? This is the diagram that came out of what are the 5 most important things to teach to your children. I think it's important because it gives you an idea of the values, beliefs, and experiences of Indigenous peoples within this community. And of course, some will be different, and even some have a label that can be interpreted in many different ways. But what came out of this is looking at relationships, and this one kind of relates to the resilience tools that you saw earlier, is relationships with the human, natural, spiritual realms. Looking at connection to the natural environment, for example, that when we talk about connection to homeland. And so Indigenous peoples in our creation stories and our oral history and philosophies have been here since the beginning of time. We've always been here and have come into creation and from our centers of the world. And so from a scientific perspective, though, because science often, people feel more concrete with science, that from a scientific perspective, Indigenous peoples from this area have been carbon dated 7 to 12,000 years. And so when we talk about connection to homeland, Hupa always say, "Wachwo ayaden, wachwen ayaden." My mother's mothers walked here before me. My father's mothers walked here before me. So when you think about this idea that in prayer, when we're barefoot and we're dancing in place, in the same place that our mothers danced 12,000 years before. That's Wachwo Yaden, Wachwen Yaden. That's the connection to the natural environment. And that's different, that connection to homeland, than just seeing a place and having a love or a connection to it. It's being of a place, being a caretaker, a steward of that place. And so this was identified by Hupa Yurak Karuk people as an important thing to teach to our children. Another example of that is connections with gathering sites, with wildlife. My grandma always used to tease that when you look for a partner, you want to watch how they clean a fish. And because when you're taking a life of a fish, and you pay attention to how that person treats that life that they're taking, and you'll notice that so many Indigenous peoples have such respect and reverence when working with deer meat and with working with salmon. It's a part of that Indigenous knowledge. In addition to that is human relationships. And we talk about oftentimes extended families and Indigenous communities. But oftentimes we have people that are aunt or uncle that aren't even biologically related, but there's a spiritual relationship, a spiritual connection. And community members have identified this as important to teach to our children. Another example of that is looking at ceremony or song, that songs and regalia have their own spiritual life, and how to care for that life, how to take regalia and air it out, how to sing to it. These are all things that are part of this worldview, values, experiences, and beliefs. And on top of that, connections with the cultural skills like traditional games like stick games, card games, basket making, fishing, hunting, and then values such as generosity, sincerity, having a good heart. And that's one thing in interviews that came up, is one of the elders talked about a word, sindiante, which could mean thank you, but it also is something that an elder might tell a young person is, I wish you a long life. And they talk about these young people having this good heart, caring for each other. And so while we were introduced to many of the demographics, many of the social indicators of Indigenous peoples, and we talked about having the highest risks and the highest rates of suicide, suicidal ideations, death due to violence, dropout rates, teen pregnancy, all of the health disparities. While we're talking about those assessments from an external perspective, it's also important to understand what is important to the community themselves. What is the assessment that they're striving for? And if we look at the goal, and these are the 5 most important things to teach to my children that come out on this diagram, and we look at then how we are doing on this assessment from this worldview and this perspective, then Indigenous peoples are thriving. They're excelling. The number of language speakers are increasing. The people and the connection to the natural environment, regalia makers, basket makers. I think one important thing on this diagram that you can see with the dotted line is language. Is that in this study is that every single weave that you see of all these circles is all connected with language. And that's another important part of this Indigenous worldview and philosophy. So this is just one study from Hupa Yurak Karuk people, involved 350 participants, but it gives you an idea. And there's many other perspectives that are out there too. We want to be careful about misplaced concreteness, where we come up with one definition and we say this is it for everybody, because it isn't, but it gives you an example. So this is, we talk about bias. And so if you ever have participated in anti-bias trainings or unbiased trainings, from a developmental perspective, it's actually impossible to be anti-bias or not to be biased. Sometimes we think of bias as even a bad word, but bias is something that all human beings have. Every human being has bias. And as a matter of fact, in utero, when a woman is 5 months pregnant, her child can tell the difference between the parents' voices and strangers' voices at 5 months utero, when she's 5 months pregnant. And this is a part of bias and discrimination, is that the child can differentiate these sounds, and of course has this positive response towards the sounds that's heard. And so this is done by looking at, the brain waves and the heart rate and this sort of thing that look at these studies. And so oftentimes when children are born, they're told to speak to your child because the child has been hearing your voice. And so they have a bias toward the sound of your voice. And by the time a child is 3 months old, they've already mastered their bias. Now they're become accustomed to certain smells, certain sounds, being rocked in a certain way, certain people. And this is how we develop bias. So as human beings, bias is a natural part of being a human. And so the trick is how to be aware of our bias. How do we become aware of it, and how it influences, once again, our interpretations, our expectations, and our assumptions of other people. And so we have 2 types of bias. We have explicit bias and we have implicit bias. And so explicit bias is the bias that we know that we have. And so we're aware of it. And we may be willing or not willing to unveil this bias to others, but we know that it's there. And we also know that when pockets are nurtured for this bias, that people become comfortable, and so they unveil the bias. And so an example of this type of bias might be that I might be circled by people who I assume are lovers of children. So if I were to say that my children are the brightest, most kindest children that exist, in this particular setting, it probably would be supported for me to say that. Whereas I might not say it in another setting where maybe it didn't feel as safe to share that information. And that's kind of a topical example. Another topical example might be if I'm a Giants fan and I'm surrounded by Giants fans, I might be more willing to, talk about my bias. Whereas if I'm not, maybe I wouldn't be, or maybe that would be all the more reason to. We're not really sure, but I can unveil that bias at any time. We also see this in environments that sometimes during different eras, people will say it seems like there's more racism and discrimination than perhaps there was at a different era in time. And what is happening in these situations is that there's pockets that nurture it. And when there's pockets that nurture this type of bias and discrimination that always exists, then people come out, feel more comfortable coming out with this explicit bias that they know that they have. But the other type of bias is implicit bias. And implicit bias is a bias that we're not even aware that we have. So even if we wanted to share it with other people, we're not even aware that it's there. And so there have been different studies done looking at this type of bias. And it happens with this type 1 and type 2 thinking. And so when we think in a very quick second, we're using more reactive thinking. That's typically when our implicit bias is unveiled. When we're thinking more reflectively and taking time to make our decisions, is when we're able to kind of be more aware of these biases. And so this picture here is just a kind of practice to see, just for an example, just looking at colors, our implicit bias. And so if you read column 1, 2, and 3, and you don't have to unmute, but just give a chance to read it. What you're going to do is say the color of what it is that you see and try to say it as fast as you can. So as soon as you finish column 1, move to column 2, and then directly to column 3, saying the color. Okay, did you have any trouble getting through these? So sometimes people are colorblind and it does make it difficult, but typically you're able to go through each of the columns without much struggle. So now we're going to try it again. And this time you're going to say the color of column 1, column 2, and then column 3 as fast as you can. So continue to say the color. Any trouble? Okay, so now we're going to try the next one, and you're going to say once again the color that you see all the way through column 1, 2, 3 as fast as you can. Okay, so sometimes this one is a little more difficult, and it's a little more difficult because when we saw this previous slide where it actually says green in writing, red, purple. So it says the same thing that we see with the color. And so it's type 1 thinking. It's very easy. It doesn't challenge our brains. So we're able to just read through them quickly. Whereas this one reads something different than the color that it's actually listed as. And so it challenges our thinking. It gives us a different result than what our brain is expected to see. And so every millisecond that it takes longer, according to Jerry King and his research, every millisecond it takes longer for us to differentiate is actually a deviant of our bias. And so even with something, looking at colors, and this isn't even talking about some of the deeper levels of discussion, but it's the difference between type 1 and type 2 thinking. When we have to challenge ourselves to think something different than our brain wants to think, that's evidence of our bias. And so it takes longer for us to figure these things out. And so we know that bias is a part of our human nature. And we know that we have these social mind bugs. They're an aspect of that implicit bias, and they're ingrained habits of thought. And they lead to errors in how we perceive, remember, reason, and make decisions. And this is important because if we have a client come into our office, and oftentimes we have this immediate thought about this client, and we have all of this information that we think we know based on what we've been conditioned to believe from the media and from, in many cases with Indigenous peoples, from Hollywood and from other places, that when an Indigenous person comes into our office, we sometimes have all of this type 1 thinking, all these immediate thoughts about this person. And so it's so important to challenge ourselves to utilize this type 2 thinking. And so we have these social mind bugs that oftentimes fill in the blanks for us. And we think that because there's something that we see in a person that is familiar, that sometimes we fill it in with something else. So in Jerry King's research, and an example of that, what he utilizes in law is if someone came in to this room right now and they were to grab this cup, and we all witnessed it happen. Well, I might ask you, so when the person with the red sweatshirt came in and grabbed this cup, what did they say? And part of social mind bug is, now that I have said about this red sweatshirt, you immediately put this red sweatshirt on the person in your memory. It's how our brain pieces together things that we can't remember. It's the reason why when we read a whole paragraph that has no vowels in it at all, but we can read it, it's the mind bugs within our brain that are able to piece that together, and we're able to read it. We use this in texting now, where we just have random letters, but we're able to read it because our brain pieces it all together. And we do this is for information we don't know, our brain pieces it together for us. The trouble is when we meet other human beings, we do that also. So we take statistics of everything we see within them and what we don't know about them. Our brain sometimes pieces things together based off of other things we've been conditioned to believe about people that might have the same demographic or same information. So that's important to be aware of these social mind bugs when working with people. The other is the cloning mechanism, is that sometimes we find similarities within people. And so we might feel that we have a connection with them that maybe we don't. So for example, they might be the same tribe, or they might be from the same geographical region, or they might be from a family that we're familiar with, but it's still important to understand that they have their own values, beliefs, and experiences, and that just because we know one person from the community doesn't mean that defines all people. And we have this desire to have connection with people. And so sometimes without realizing it, and when we're in positions of power, like as we don't realize it, but social workers, educators, medical professionals are all in positions of power, even though we don't necessarily ask for that position of power. Sometimes in our desire to make a connection with people, we make assumptions about them that actually aren't accurate. or we try to make connections with them that really aren't connections, but somehow they make us feel more a part of it. And it's important that we as professionals are sometimes the ones that feel uncomfortable in the process so that our clients can feel comfortable. So not knowing about a person is okay. Being vulnerable and talking to that person about their needs is okay. That sometimes as a professional, we don't need to have the answers to everything, including all of the information about this particular person. The other thing we'll also talk about here is the monological epistemology versus multilogical. Monological is believing that there's one truth, and multilogical is multiple truths, that things can exist in multiple ways. And this one is often very challenging, especially if it fits different than what our belief might be. But understanding that everyone sees things from their own perspective, and there can be multiple truths to things. This becomes most challenging for me with siblings, for example. When you have a memory from childhood and in your mind you're thinking this is the truth of what happened, that would be monological thinking. But being able to say, okay, well, from their perspective, that's how it happened. That would be a more multilogical perspective. The same thing in looking at historical events. There's multiple perspectives, and looking at different forms of healthcare and that sort of thing can also be looking from a multilogical perspective as well. And so this is just kind of an exercise to help you to think from this more multilogical sort of lens, that there can be multiple truths and these truths can coexist. And so when you look at this picture here, what do you see? And so I'll just give you a moment to look at the picture. Okay. So some people, when they look at the picture, they see an older woman. And this older woman that they see, this is her forehead here, and this is her eye, her nose, this is her mouth, the chin, and kind of wrinkles on the side of her face here. And so they see this older woman. Other people, when they see the image, they'll see a younger woman. And this is her forehead, and this here is her chin. And this is actually her ear and her hair coming down, her eye, her nose, her mouth. And so the idea of this photo is that they both coexist, that you can see the older woman and you can see the younger woman, and that we only become more enriched when we see more. It doesn't have to be just seeing one or the other, that we can see things in multiple ways. And why we're talking about this for this particular training is that we're going to be learning things from multiple perspectives, and that there can be more than one truth. This is another picture, and looking at this picture, just take a moment to see, what do you see in this particular image? So some people, when they see this picture, they notice the lagoon, and some people identify it as a lagoon if they've experienced or been around a lagoon that looks similar. Some describe it as a bay or an ocean. Even that is based on a person's personal experience. But most people identify that there is a couple standing here and they're in front of the water. Other people might notice that there's also a baby in the picture. And looking at this baby, you can see the baby, it's almost similar to a fetus. This is the face and the head, the arms here, the bottom, and the legs. And so then once people see the baby, then that kind of stands out to them, but they're still able to see the water and the couple. And this is a part of that coexistence of being able to see multiple perspectives, and they actually enrich each other rather than challenge each other. This is another image that helps you to think in a more multilogical perspective. So in this image, oftentimes people, identify the larger bird. There's a large bird. Sometimes people identify that the bird has something in its mouth. And so I think one of the things that's important is that when we're looking at multiple perspectives and when we're working with children and families and their communities, and we're looking at things in multiple perspectives, that sometimes we have to really challenge ourselves to see it in a different way. Sometimes our own privilege still requires it to be presented to us in a certain way. And so we may say, I'm really trying to see their perspective, but I just don't see it. Sometimes it means getting uncomfortable. And in this case, completely turning yourself upside down in order to be able to see something new, in order to grow, in order to develop. One of the things that I like to tell my students is that sometimes when we're in these positions of power, that in order to grow, we have to be the ones to be uncomfortable, so that the clients that we're working with can have that support and the comfort. Sometimes we utilize our positions of power to be able to nurture and keep ourselves safe, keep ourselves comfortable. And in doing that, we miss out on the being able to be enriched and seeing something at a deeper level. And so in this picture, then you can see that there's a man in a canoe or a boat, and it may be even be a woman in a boat with a hat on. This larger fish here, island, the trees, and you can see the water here. And so these are just exercises of how we can self-reflect to try to be able to see things from the perspective of our clients, how we can be aware of how our worldview, how our privileges, how our biases influence our interpretation, expectations, and assumptions of the people that we're working with. And so one of the challenges here is to really shift the paradigm from this one truth to more of a multilogical framework where we can see multiple perspectives. And when we're including Indigenous knowledge into ACEs, for example, we're really looking at multiple perspectives. We're including an Indigenous perspective into this discussion of ACEs and social determinants of health. And so some things that are important to think about is how do I benefit from the current institutional framework of things? Am I aware of my position of power within the system? And do I take extra steps to create safe spaces for my clients? And then this goes back to the trauma-informed care approach, which we're looking for a foundation grounded in trauma-informed principles and a team approach, an environment that's calm, safe, and empowering, education about the impacts of current and past trauma on health, and then, of course, the inquiry about and response to recent and past trauma that includes on-site or community-based resources and treatments. And once again, this clinical response overview that we talked about earlier in the session about applying principles of trauma-informed care and also supplemental usual care for ACE-associated health conditions by providing patient education on toxic stress and offering strategies to regulate the stress response.